Hi, everyone, and welcome to this week's Wellness Wednesday episode of our Arthritis at Home program. My name is Maya, and I'm the program coordinator at Arthritis Consumer Experts. I'm so pleased to be speaking today with Dr. Mary de Vera on the topic of managing homeschooling, work, and wellness during COVID-19. Dr. Mary de Vera holds a PhD in Epidemiology and is an assistant professor at the University of British Columbia's Faculty of Pharmaceutical Sciences, where she holds a Tier 2 Canada Research Chair. The goal of her research is to support patient journeys in living with disease. She conducts population research using big data, as well as surveys to evaluate health problems at the population level in both arthritis and cancer, as well as qualitative research to draw on patients' perspectives to explain findings or develop solutions. She holds a Tier 2 Canada Research Chair and is a Michael Smith for Health Research Scholar. Dr. de Vera also has two beautiful daughters who I'm very excited are making a little cameo appearance right now. So thank you so much for joining us, Mary, and thank you for joining us also, Monica and Valerie.
Thank you. So thank you for having us.
Thank you for having us.
Our pleasure. So over the last month and a bit now, because of COVID, as we know, there's school closures, daycare closures, and that means that your mom, Dr. de Vera, is spending lots of time at home with you guys while also working. So can you tell us what that experience has been like for you, Mary, and for you girls?
Okay, so I think it's just been I guess that analogy that people always use is like juggling. So it is juggling working time with school time, with daycare time, with family time, and just making it work. So, we always thinking about how lucky we are that mommy has a job and that we have great support from school and healthy and that we can be together during this time, and that it's not forever, and that this is a great time to just kind of be together as a family. What about you, Monica?
I don't know.
Okay, you don't have to. What about you, Valerie?
I don't know.
Okay, we don't have to know. Okay.
So what I wanted to ask you is, many parents like yourself are juggling a full-time job, managing a chronic disease, or both. What advice would you give to parents who are in this situation from your own experience, trying to manage work, homeschooling, as well as their own health and well-being?
Okay, so I guess I've been thinking about this. So one advice that I have, and what's really worked for us, and a lot of this is like trial and error. I think we've been in social distancing or quarantining for almost 8 weeks now, right? Since the middle of March. So what's working for us is to set some sort of like schedule. But when I say that very loosely. So for us, for our family, we wake up, we have our breakfast, we make the beds, and then we go for a family morning walk, rain or shine. And then we're really lucky with Monica's school. They do a lot of online Zoom lessons. She actually has more Zoom lessons than me. So then when we come back from family walk, Monica has her 9:30 attendance, and they usually have math or science. And then she usually finishes between 10 and 10:30. And then she has a snack. And then Valerie also has a snack. And then at 11:15, she has online PE class. And then they also actually do meditation, which is really great. And then we have lunch at 12. And then the afternoon is kind of do it yourself home learning. But then we guide her through her reading.
After we do biking.
And then we do biking, and then we have dinner. So I think just setting some sort of like really helps. So that's kind of like one advice. The other advice is, I guess, to let people know. So everybody's saying we're all looking out for each other. So I've actually told or asked my colleagues and my research team that, because I am working around a homeschool and a daycare, if I'm going to have Zoom, ideally it's between 10 and 12, because that's then when Monica's in her lessons. And then in the afternoon, it's between 2 and 4, which is when Monica's doing reading or quiet time and Valerie's napping. And people have been really accommodating. And basically that's when Yes, yeah. Yes, yeah. You have to nap always because that's when mom works. So yeah, so tell others and let others help you. And then the last advice, and we're all being asked and told to be kind to others, but I think we have to be kind to ourselves too. And so, like for me, my husband and I have always been particular about screen time, but right now we need technology more than ever, and we are using the computer and iPads and tablets more than ever. So we're a bit more forgiving about screen time. We're also, for me, I get really anxious when I see a messy house, but now, like, we pick the background, which is the less messiest part of the house. So yeah, just be kind and just things, again, this is temporary, it's not forever. And then find those quiet times when you can spend time with yourself. For me, even if it's just like 5 minutes in the bathroom, just be kind to yourself.
I'm so happy that you emphasized that, because it is so important, caring for parents caring for themselves as well as their wonderful children.
You want to go? Okay, say thank you and bye.
Bye, Vera. It was so nice to meet you. The next thing I was wondering is, are there like certain activities that you've found to be very good for keeping everybody entertained and low energy?
Yes, actually, I was thinking about this, and I've come up with some mom hacks that have really worked for me during the pandemic. And one of them actually solves a little bit of my worries around the house getting too messy. So I have just these boxes where every week I kind of put the toys away, and then I stash them away in the basement. And then I've been cycling them. So like a new box comes up, and then they open it up and opening new toys, because kids, like, a lot of the toys is like novelty. They open it and then they play for 10 minutes and then it's gone. And then when they have all their toys out, which is like stressful for moms, they're like, oh my god, so much mess, but then they're overwhelmed because they don't know what to play with. So this way it kind of keeps the house contained, and then they're like opening a new toy box every week. So I highly recommend that. It's very low energy, and it gets you at least a solid hour of playing, and you're keeping your house clean by rotating toys.
That's amazing. I love that.
And then the other thing, it's again, it could be low energy or high energy depending on what day you're having, but it's also like a low budget operation. Go upstairs, I can hear the snacks opening. Okay, we're opening snacks. Okay, go upstairs, please. So the other thing that's low budget, and like, again, depending on the energy levels, is a scavenger hunt. And you can customize this. So I have a 7-year-old that knows how to read, and I have a 4-year-old that does not. So then we do little scavenger hunts. So for the 4-year-old, I will draw like an apple, or I would draw like a pencil. And I would draw even like toilet paper, because I know every toilet paper has been hard to find. So then I hide them all around the house, and then they will go around with their sheets of paper and then looking for these items, and then they get a check, and at the end they get a little treat. So we can also adapt this for outside, because then you can make them look for different flowers. So like now you can have a little flower map, and depending on where you live. So we live in a neighborhood where there's a lot of flowers, there's a lot of cherry blossoms. So we've been able to do scavenger hunts just with flowers. So I guess the hacks has been like kind of the way to get out of like technology. But I really recommend them because, again, it gets you some time. Like the scavenger hunt, depending on how much you put in it, could get you up to 1 hour of like activity time. And again, you can do it on a rainy day and you can do it on a nice day. So those are like my 2 main mom hacks, and they never get tired of them.
That's awesome. Yeah, because they're different every time, which is perfect.
And then I guess, and I think for the people that follow me on social media, either on my Twitter or my Instagram, I guess one of the things with the pandemic is we kind of forget what day it is. So you kind of have to make those markers. So Saturday is, they know that mommy's not doing any meetings, mommy's not doing any work, and we renamed them Saturday. So that's the day that we bake, which is perfect because the next day we call it Sugar Sunday. So I actually, I gave up sugar for Lent. So that was 40 days of not eating sugar, but then I would have a treat every Sunday. And actually, I've actually also pre-diabetes. So it actually transitioned into a lifestyle change where we bake every Saturday, and then I get to have my 1 day a week of sugar on Sugar Sunday. And then the kids love it. It gets messy, but then you get a treat at the end of it. And then they know that it's Saturday because we're Saturday baking. And they know it's sugar Sunday because we're eating sugar, and that's how we've been marking our weeks.
That sounds like the perfect way to mark your week. Something to look forward to, sweet stuff. It has everything.
Yeah.
You mentioned that Monica has Zoom classes with her teachers, and you are helping with like reading and stuff. Have you found have you felt comfortable like communicating with her teachers about what's going on at home, and if you are working on a project or something, like how does that work? Communication with teachers during this time.
Yeah, so I'm really lucky with the school that we have, and just the staff there. They've been really supportive. So I guess for our particular school, we are working off like this learning platform where all the assignments are put in for the kids, and then it outlines with when they've been posted and when they're due, which ones are optional, which ones are, because sometimes we just have enough time to do the mandatory ones. And then, with the teachers, they've also been very supportive. They actually, in the beginning of the pandemic, they sent a survey to ask what are our technology needs, what technology we have access to, and what are parents' working situations, who are parents working with frontline. So the school has been able to provide support and give some flexibility. I recognize that we're also lucky that Monica is 7, she's in grade 2. So none of the schooling is actually, I think we can catch up, but there is still like, again, a prescription we're following. And then we do work that into our day. So that becomes our quiet time in the afternoon when she and I go through her lessons of the week and which homework we're gonna do, and which ones that are not required that we're not gonna do, because we have to juggle the time, right? Because mommy still has to work.
Yeah, no, 100%. And that, it sounds like there's support in communicating with the teachers, and as you mentioned, communicating with your coworkers, your colleagues, letting them know what's going on. I think that's so important to emphasize, that people are there to help you and to support you, and not to be afraid to reach out to those.
Absolutely. And kids, do your homework.
Is there anything else, any like last words of wisdom or support that you'd want to share with other parents in your situation right now?
I think it's just to just enjoy the time during this time. Yeah, I mean, we're spending more time with our families, but it's really time that is precious. So my 4-year-old Valerie, she just learned how to bike without pedal bike. So we bypassed training wheels. And really, I think we were able to do that because we were spending time every day in an empty parking lot by our house and just working on it. And then when I think about, okay, had I been going to work, had I been going to daycare, like that time would not have been available to us. And I don't know when she would have learned how to bike, but now she is like biking around, and which is great because now I can take them to that same parking lot. I plop down a yoga mat and I do some yoga stretches while they're biking in a parking lot. And then during this time, they've really upped their baking game. So I honestly just take videos and pictures while they bake, and then clean up the mess after. So the time, although it's like, like the days are dragging and we're just like spending too much time with each other, like there's so much that could come out of that. And I guess when I think about like one day they're going to be not home, I'm like, at least I had this concentrated time where they were just like home with me like for 24 hours. And yeah, we've driven each other crazy. So yeah.
Yeah, no, it's very true.
Yeah, so I'm thinking about that. And I have some friends or family that are like have older kids, and actually on the flip side with them, they've like empty nesting to full house. And they've also saying that like it's actually been really a blessing to have that time with their kids that they would not have been able to have. So yeah, just enjoy the time.
No, it's so true. These unprecedented circumstances also mean an unprecedented amount of time together as a family. That's a nice silver lining for sure. Thank you so much for sharing this insight. And now we're going to do a bit of a pivot here and talk about your research, because it's super interesting, super relevant to patients like myself. So yeah, if you wouldn't mind speaking about your unified study.
I'm really lucky that I still get to do my job and do it from home. And as an epidemiologist, I think a lot of people are learning what epidemiologists do during a pandemic. It's hard to sit by and not try to do anything. But because I'm not the person that's going to solve COVID-19, I do have to see how I can make an impact on the diseases that I study that it touches on. So 2 weeks ago, we launched the Unified study. So the website is www.unifiedcovid.com. And what it is we're doing an international survey to look at how COVID-19 has impacted like the care, access to medications, and really importantly, mental health patients with arthritis, as well as cancer, who are particularly vulnerable to COVID-19 because like the immunocompromised states they're in. We hear it about it a lot. We see it, on social media. I see it in patient communities that I'm part of, but it hasn't been reported in research yet. And I think it's an opportunity to use research to actually raise awareness of the issues that we know. So yeah, I'm just asking for help and spreading the word. So it's been open for 2 weeks, and I think we're almost at 300 for the rheumatology survey. So that was great.
That's awesome. Well, hopefully we can help you promote that, push that, and get all of our viewers, if you're living with arthritis or cancer, or if you know somebody who is, to pass this research on, and we'll link the study so people can get involved.
Thank you. I really appreciate that.
Oh, wonderful. Well, thank you so much, Dr. Vera. It's been such a pleasure talking with you. I wish we could keep chatting. Wish I could hang out more with your girls. They're adorable. Yeah, thank you so much. And thank you to our viewers. Please feel free to leave feedback and join us for our next video on Facts Friday.
Thank you.